The talk should take about 45 minutes, or what I have to say should take about 45 minutes or so. We will have time for questions at the end. If you're able to drop your questions in the question box, in the comment box, we will address the questions. If you're not tech savvy or if you're calling in from your phone, when it's time for a question and answer, just feel free to open your mic and ask your question. I will do my very best to answer to my ability, and if I'm unable to answer, I will get back to you and we can have a discussion at another time. That being said, I'm going to begin to share my screen, and we're going to ride this out together, ladies. We are going to ride this out together. Hallelujah. So tonight's talk is
sharing your screen.
Women. Oh, I'm sorry. Thank you. Sorry, guys. All right. Here.
It's showing on me.
Okay. So tonight's talk is on women's health awareness. Let's see. Okay. So our objectives for tonight are to learn the importance. I just need to close this. I'm sorry. Okay. Oh no. What did I do? Okay. To learn the importance of recognizing heart disease in women, gain a clear understanding of what heart disease is, explore the risk factors for heart disease and how they differ in women from those in men. We're going to discuss the differences in how women exhibit symptoms during a heart attack and learn the steps for maintaining a healthy heart. Why should women educate themselves about heart disease? So I'm going to share some sobering facts, many which will likely surprise you. Heart disease is a women's health crisis. Heart disease is the leading cause of death for women in the United States and actually worldwide. Every 80 seconds, a woman dies from heart disease. About 54% of women don't know that heart disease is their greatest risk. Most women believe that breast cancer is the leading cause of death in women. Breast cancer is the most common cancer in women in the United States, but thanks to aggressive screening and education, it's not what we are dying from. 1 in 31 women die from breast cancer every year in the United States, while 1 in 3 women die from heart disease every year. So that's 33% of women die from heart disease every year, in comparison to 3% of women that are dying from breast cancer. That's a 10 times higher incidence of death by heart disease. I'm sure many of you are probably surprised to know that breast cancer kills so fewer women when compared to cardiovascular disease. I'm going to ask you to drop a heart in the comment box if you thought breast cancer killed more women than heart disease. In fact, heart disease kills more women than all the cancers combined. Another reason it's important for us to understand heart disease as a woman's issue is because it is the leading cause of death in new mothers. It accounts for 1/3 of all maternal deaths. So we can get an idea of the importance of understanding that this is a true health crisis for women of all ages. So what is heart disease? What do I mean when I say heart disease? I may use the term cardiovascular disease as well. I kind of interchange the terms. But what is heart disease? What are we talking about here? Heart disease really is an umbrella term that refers to diseases of the heart and blood vessels. It includes coronary artery disease, heart attack or myocardial infarction, stroke, heart failure, arrhythmias, and heart valve disease. Our focus tonight will be on heart attacks because it is what we are dying from primarily. But I will briefly define some of these terms on the following slides. So coronary artery disease is a disease of the blood vessels that supply the heart muscle with its blood supply. The heart is responsible for supplying blood throughout the circulation to muscles and tissues throughout the body, but it has its own heart supply. And that comes through the coronary arteries. And when there's plaque buildup, which is what we're seeing, what's depicted here by this yellow portions of the blood vessel wall, when plaque buildup in these arteries, it causes a narrowing of the blood vessels. And that is what is defined as coronary artery disease. It's also termed atherosclerosis. Heart attack or myocardial infarction occurs when the heart muscle is deprived of blood supply. So the coronary arteries are unable, blood is unable to reach the heart muscle. And that can be due to a blockage in the blood vessel. It can be due to spasms in the blood vessels or tearing of the coronary arteries. Heart attack leads to heart muscle death. It can lead to decreased cardiac function or heart failure. And of course, it can also lead to death. A stroke is a disruption of blood supply to the brain. People don't often connect a stroke as cardiovascular disease, but it's a disease of the blood vessels of the brain. If there's an obstruction to blood supply to the brain, whether it be by a clot or to a bleeding of a blood vessel, and the brain is deprived of its blood supply, that is what is defined as a stroke. Heart failure is the inability of the heart to sufficiently pump and send blood into circulation. And so that leads to poor organ or tissue perfusion. It also leads to inability for the body to adequately control its blood volume. We see patients that end up with it's edema, swelling of the body, of the limbs, of the lungs, because this fluid ends up backing up into the heart because it's unable to squeeze out its volume. It can be a result of a heart attack, and it's also seen in postpartum women. I remember when I was an early PA working at Kings County, this young woman came in with very advanced heart failure. She was in her mid-20s, and she had just had a baby. She had a baby the week before and came in with advanced heart failure, where she was not able to even walk from her bed to the door. And all she did was have a baby. A lot of us don't realize that pregnancy does hold a lot of risk factors in regards to heart disease. Arrhythmias are abnormal heart rhythms. The heart is electrical. It's electrical impulses that leads its rhythm, its beating. And so if there is any issues with that or any complications, the heart can develop rhythms that are not normal, either too fast or too slow. And there's also valvular disease. Oh, 1 second. Okay, I don't want to move that. The valves can become stiffened or loosened. And there's four valves in the heart, and their function is pretty much to keep the blood in the appropriate chambers of the heart and to ensure proper direction of blood flow in and out of the heart. Complications with the valves can lead to heart failure and even high blood pressure within the arteries of the lungs, which is called pulmonary hypertension. A lot of people don't even know that you can develop high blood pressure in the vasculature of your lungs. So how does a heart attack happen? I'm going to get a little sciencey here, but I think having a visual is really going to help you understand what's happening in the heart when a person is having a heart attack. So this is a cross section of the coronary arteries. The coronary arteries, like I mentioned, are those blood vessels that supply the heart tissue with its blood supply. This first depiction here is a nice or normal, clean coronary artery. Just probably exists when you are maybe 2 months old. As we grow and get older, we develop plaque deposits or depositions within the walls of the blood vessels. And this happens over time. This can happen due to family history. It can be caused by due lifestyle. So what happens with a heart attack is this plaque develops, and then there's a disruption. This is what we see here being depicted, is a disruption in the wall of the blood vessel. And that can happen because of elevated blood pressures, emotional or physical stress, and sometimes that can just be unprovoked. And so whenever the body has injury, it's what it does, it develops what's called a thrombus or a clot. And that is part of the healing of the tissue. So as the thrombus continues to enlarge, or if it becomes as the thrombus develops, as you can see, the blood now is kind of funneling through this blood vessel. So we're having a decreased blood supply just by this thrombus being there in response to that injury to the blood vessel wall. If the clot completely obstructs that blood vessel wall, now we have a heart attack. This is what a heart attack looks like on the inside. There was no blood supply passing through this blood vessel. There was no blood getting to the heart muscle. And the heart muscle, which you see by this darkened color here, that's depicting the death of the heart muscle, and which can happen in minutes. So time is heart muscle. This is an emergency. I'm going to, Malka, are there any questions in the chat right now I can kind of address? If you have any questions up to this point, like I said, this last section was a little sciencey. So if there are any questions, I can briefly answer them, or we can just continue and move forward.
There's no questions at this time.
All right, excellent. So risk factors. Risk factors are very interesting. And they're interesting because they're the same and the different between men and women. So they're largely the same for men and women, but even within those that we share, women are affected differently by those very same risk factors. And then there are risk factors that are specific to women alone. So let's go ahead and take a look at that. So the risk factors that are shared between, across the board, these are the risk factors for developing heart disease: diabetes, being overweight or obesity, physical inactivity, smoking, high cholesterol, and high blood pressure. And an important risk factor that is not included on this slide is family history. Family history really increases your chances, especially if it's your parent or a sibling. If they have heart disease, you are at an increased risk of developing heart disease. And one of the things that we did during our intake form for signing up was to ask how many people had family history of heart disease. And 57% of the respondents, of you guys, you ladies who responded, 57% of you have a family history of heart disease, which means that you are at an increased risk of heart disease. I'm at an increased risk of heart disease. Malk is at an increased risk of heart disease. Both of our parents have heart disease. Our fathers had a complete heart attack and complications surrounding that. So it's the majority of us are at an increased risk for heart disease. And DNA is what it is. There's some things we can and can't change. We can't change our DNA. And so we have to deal with that and try to mitigate the risk that we are able to control. So diabetes increases People with diabetes are at a 2 to 4 times increased risk of developing cardiovascular disease. It's that increased sugar, diabetes, people take it for granted that your sugar is high, take some insulin, your sugar is high, drink some water, your sugar is high, do whatever you think. But the sugar is having an effect on your blood tissues. It's circulating and it's causing damage to the blood vessel wall. That is how the blood vessel walls become weakened and are prone to injury, like that leads to that thrombus, that clot being developed. It's because of the insult to the blood vessel wall. And sugar is one of those things that causes insult to the blood vessel wall. Women with diabetes have heart attacks earlier than men. Okay, it's a risk factor for both of us, but women will have a heart attack earlier than a man with diabetes, and it's more likely to be fatal in women. Okay. Obesity, being overweight, is an independent risk factor for developing heart disease. That means independent risk factor means that it contributes significantly to the likelihood of developing cardiovascular disease. Excess body fat is inflammatory. It's not just unattractive to some people, it's not just dimpling of the skin. It is an organ. It has a function. It causes inflammation in the body. This inflammation leads to inflammations in the blood vessels. It leads to increased plaque buildup within the vessel walls. And its effects are compounded in the presence of high blood pressure, diabetes, and high cholesterol. In fact, obesity increases the risk of developing heart disease by 64% in women compared to only 46% in men. Again, shared risk, but affects us differently. Physical inactivity. Physical inactivity can be defined by just not meeting the recommended level of physical activity. It can also refer to living a sedentary lifestyle. It increases the likelihood of developing high blood pressure, high cholesterol, diabetes, and obesity. And women, for some reason, according to the literature, are more likely to be inactive as compared to men. Smoking and heart disease. Fascinating tidbit that I learned. The reason why heart disease is often thought of as a man's disease is because that's where the research started. I came across a very interesting article, like 1912, that described heart disease, and they were focused on men because, according to their observation, women weren't having heart disease. That it just wasn't what they were seeing. And the reason why. The big reason why in this instance where they weren't seeing it as much as women is because men were smokers. Women weren't. It was not socially acceptable for women to smoke. But as women became liberal and started picking up the habit and became less of a social, it became more socially acceptable for women to smoke, the incidence of heart disease raised increasingly over the decades when that began to happen. But because science and research was stuck on heart disease is a man's disease, they never started, the research fell off, essentially. They just weren't paying attention to the changes, which is why we're here today where, it's what's killing us, because the mindset, the science research has not caught. I mean, it's improving, obviously, but it's lagged behind because of that mindset. The chemicals in cigarette smoke directly damage the blood vessel wall. And when I say the chemicals in cigarette, vaping, cigars, all of it, all of these things that we inhale and that can inhale or that have chemicals are going to exert damage on the blood vessel and our blood vessel walls. It thickens the blood, it increases triglycerides, and it lowers our HDL cholesterol, and HDL is our good cholesterol. And I will touch on that in a few slides that are upcoming. Women that smoke have a 25% higher risk of developing heart disease compared to men that smoke. Again, same risk factor, it affects us differently. High cholesterol has the highest impact on developing heart disease. Higher levels of fat and cholesterol circulating in the blood leads to increased deposition into the blood vessel walls. So we have this wall injury, wall damage, fat deposition. That's the pathophysiology. That's what happens in developing these plaques. And after a woman enters menopause, her risk factors for developing heart disease really is equal to that of a man. Prior to menopause, estrogen is termed cardioprotective. It really helps to protect us, which is another reason why they didn't believe women had heart disease, because we got it so much later. It was these young men. Men tend to develop heart disease 10 years earlier than women, so about their mid-30s. So the focus were, these young men are all dying, leaving their wives. This is 1912, right? The typical household. Women stayed home, men were the breadwinners. So why are all our 35-year-old men dying? We have to figure out why and focus on that. But what ends up happening is once a woman enters menopause, she's on par with developing heart disease as if she was a man, because the estrogen protection is no longer there. HDL, simply put, is a good cholesterol. That's the protein, the cholesterol that helps remove helps to remove the bad cholesterol out of the blood and into the liver for processing. LDL cholesterol, that's what gets carried into our blood vessel walls, leading to that atherosclerosis, that plaque buildup that we saw earlier. High blood pressure. I tell you, high blood pressure is the leading risk for heart disease in women. High blood pressure, to explain it simply, is essentially blood pressure is made up of two numbers. Most of you may know. The first number is a measurement of the pressure as blood is leaving the heart, which is going to be the higher number. And then, so the beginning of the cardiac cycle. And that second number, which is called the diastolic number, is at the end of the cardiac cycle. And so those pressures are expected to be lower. So, high blood pressure is really it's a way to understand the exertion of blood against the blood vessel walls. Like, really high blood pressure really means a lot of friction against the blood vessel walls, which can lead to injury. In the brain, it can lead to a stroke, which is, a brain or by a blood vessel bleeding. Black women have a higher incidence of high blood pressure than any other race or ethnic group. Approximately 41% of women have high blood pressure that is undiagnosed. It is famously referred to as the silent killer. And it's the silent killer because you're mostly without a symptom until your pressures are very high. And at that point, it's been high, and it's been increasing over time. And at some point, if you're fortunate enough that you develop symptoms, I can share with you my diagnosis of high blood pressure. I was getting medical clearance for a telemedicine job I was, going to start to do on the side. And I had to get clearance. We had to go to employee health. She did my blood pressure. It was high. And I was like, no, it's not. There's something wrong with your machine. I just woke up. I just had coffee. I just rushed in. I have reasons for my pressure to be high, which is ridiculous, right? She said, okay, sit down, relax a little, and we'll repeat it, which she did, and it was normal. And I was like, in my head, I was like, I told you so. arrogant, and foolish because I didn't see myself. I don't expect to be hypertensive. I don't add salt to my food. I work out. I am conscious about the things that I eat and the things that I do. I am not going to have high blood pressure. You got the wrong person. But high blood pressure, cardiovascular disease, especially with a family history, you can do all the things. But if you have predisposition to developing heart disease, it's very likely going to come and get you at some point to one degree or another. It can be, full onslaught, or it can be mild. But you have to realize that the possibility exists. Back to my story. So didn't consider it again. 6 months later, this was about July of that year, 2023. January 2024, I had the most blinding headache. Headache wouldn't go away. I had a blood pressure machine, checked my blood pressure. It was high. And I'm like, oh, it's probably high because of the headache and da 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 da. Ended up going to the emergency room. Blood pressure was something, it was almost like 200 over 150, like something utterly ridiculous. Rushed me to get a CAT scan of my head to make sure I wasn't bleeding in my brain, because when your pressures are that high, that's what happens. And thankfully, that CAT scan was normal. But yeah, I'm walking around hypertensive, not knowing it. And that is what is true for most of us. It is undiagnosed, either because we're not looking for it or because we are without symptoms. It is truly a silent killer. And by the time you're diagnosed with it, it has already had years of insult and an insult to your blood vessel walls and to your cardiovascular system. And only 1 in 4 women with high blood pressure has it under control, which is unfortunate because it is easy. High blood pressure in particular is very easy to control. Okay, I shouldn't say very easy to control. It is manageable, especially with lifestyle changes. When I started, they had me on 2 medications, then I, really made certain lifestyle changes. I was already working out, was conscious of ensuring that I, maintained that habit. And then over not very long, I was just down to 1 medication. And that is what I'm still down to 1 medication. Um, and again, in regards to the differences between men and women, we tend to have it less control than men. Men are doing a better job with controlling their blood pressure. And it may also just be because men are, when it comes to heart disease and cardiovascular disease, they are just get the treatment that is warranted more often than we do. So what are some of these women-specific risk factors? That this is all ours. This is ours. Preeclampsia, which is high blood pressure during pregnancy. If you are a woman who've had that had preeclampsia, you're 2 to 4 times had a higher risk of developing high blood pressure later on in years. And preeclampsia is very prevalent in the Black community. Gestational diabetes is diabetes that develops while you're pregnant. Again, you're 10 times more likely to develop diabetes later on in life. And it is, excuse me, I just need to take a sip of water. And you're also 4 times more likely to have a heart attack. Polycystic ovarian disease is one of those risk factors that are specific to women. It is the disease of our ovaries. Early menopause. Like I mentioned before, estrogen is protective. And once you enter menopause, and particularly in this case, early menopause, you are at an increased risk for developing heart disease. Estrogen, it helps control blood lipids, it helps relax the blood vessels. As we enter menopause, body fat increases, I said, as I mentioned, body fat is an organ. It causes inflammation throughout the body. Autoimmune disease, much more common in women. We're talking about lupus, rheumatoid arthritis, ulcerative colitis. These are all pro-inflammatory. These are all conditions that really causes inflammation throughout the body. And depression and chronic stress. I mean, it's everyone can be depressed, right? And have chronic stress, but women are twice as likely to suffer from cardiac disease when they're also dealing with depression and chronic stress. Stress exerts its efforts, its effects on the body, on the nervous system, and causes a cascade of changes that directly affect the heart. And all of these factors that I mentioned are important information to share with your healthcare provider. Like, does your primary care doctor know that you had preeclampsia when you had your baby? Do you know these are the things that we need to share so that our providers have the full picture of our health. Okay, so how do you know if you're having a heart attack? I kept seeing is, I'm going to age myself, but Fred Sanford from Sanford and Son, clutching his chest, stretching his arm out, getting ready to go home to his wife. This is the big one. And that's how TV portrays it. That's how it's seen on the internet. It's always a man clutching his chest, an elderly man falling to the ground. But that is not the only indicator of having a heart attack. Chest pain is common in both men and women, but women experiences what's considered or described as atypical symptoms. In all actuality, it is proven that 30% of women are 30% less likely to report chest pain than men are. So some of the symptoms that we share are the first few, right? Nausea and vomiting, jaw, neck, and back pain, squeeze in chest pressure or pain, and shortness of breath. That's what we see most often in men. In women, we can also see the nausea and the vomiting. We will see the jaw, neck, pain in the upper back as compared to pain in just the general back for men. We don't always have chest pain. We can have lower chest pain or abdominal pain. It can really feel like it's a GI issue more than a cardiac issue. We have the shortness of breath. We have fainting, indigestion, and really feeling fatigue. And women are most likely to be sent home from the emergency room during the early signs of a heart attack. They're overlooked, and it's anxiety, it's GERD. You send them home with something for their stomach, and a referral to see their doctor the next day. If you have these symptoms that persist, you can be having a heart attack. These are those atypical symptoms that are seen primarily in women: nausea, stomach pain, dizziness, extreme fatigue, pressure or tightness in your chest. This is a medical emergency. Call 911. Don't get in the car. Don't try to take yourself. Don't send the kids up to school first, or excuse me, run that errand. Time is muscle tissue. What can we do to have a healthy heart? All right, guys, this is what we've come to learn, to find out. These are the steps to take. What do we need to do to control and ensure that we have a healthy heart? 80% of heart disease, and good news, is preventable through lifestyle changes. Lifestyle changes mean you change the way you live your life. We're not talking about popping a pill. We're not talking about making things complicated. We're talking about making changes in the way you live your everyday life. Having a healthy diet, exercise, maintaining normal blood pressure, controlling diabetes, managing cholesterol, smoking cessation, managing your stress. If you're on your phone or your tablet and you can take a screenshot, this is a screen you want to take a screenshot of, all right? These are the things, these are the lifestyle changes that you can start working on to start
Mhm.
redirecting the
Take care of your phone.
cardiac health and move towards living to your fullness. Uh, heart health diet, nutrient rich food. And this is not this is not front page news. We all know this. Protein, fruits, vegetables, whole grain, healthy fats. Minimize added salt and sugar. Just get used to your food being a little less salty and a little less sweet. Your tongue will adjust. Train your tongue. Don't let your tongue train you. Okay? Avoid processed foods. Not eating in a calorie excess, and limiting alcohol intake. The Mediterranean diet is a diet that's mostly plant-based, includes healthy fats, seafood, and limited meats. And it has been proven to reduce cardiovascular risk by 30%. The DASH diet is an approach for blood pressure control. That's a low sodium diet. Excuse me. Plant-based diet for those who are brave. Whole grains, fruits, vegetables, and plant-based. And I don't mean like the ones where you eat Oreos. I mean like healthy plant-based diet. True plant-based diet where you're incorporating a variety of plant-based foods to get all of your required nutrients. It has been proven to decrease cardiovascular disease by 15%. And I have seen, when you want to evaluate the integrity of the blood vessels, the coronary arteries, you get a procedure that's called a cath, where they just put a dye in and see how the blood circulates through your coronary arteries. And I have seen in the research and in the literature where they have people who have some kind of obstruction. We saw in the video, she's had a 99% obstruction, which is like almost obviously complete obstruction. They have cath results where you see these vessels that have some form of obstruction, and after having um, a, adopting a plant-based diet, specifically plant-based. They were trying to see the effects of plant-based diet and cardiovascular disease. And there was reversal. These blood vessels were shown. It was evident. These blood vessels were less obstructed. The plaque didn't go away entirely, but there was a reversal of the disease through a healthy plant-based diet. Okay, this is a great screen for that you could take a screenshot. A balanced plate. What does it look like? Half your plate should be fruits and vegetables. Could be all vegetables, could be all fruits, right? And you're going to have variety throughout your day. Quarter of your plate, lean protein. Another quarter of your plate, whole grains. It says here, reach into your freezer. I can tell you, these steam bags, freezer of vegetables, has upped my my vegetable intake and my family's tremendously, because it's so easy. Frozen vegetables, they're frozen when they're really fresh. They're still as nutrient packed as as fresh vegetables. Throw it in the microwave for 4 minutes, and you have a serving or two of fresh vegetables. Um, Exercise. 150 minutes of moderate exercise, 75 minutes of vigorous exercise every week, and strength training at least twice a week. Moderate exercise, dancing, walking, cycling, gardening, getting your heart rate up, right? Vigorous exercise, we're talking running, swimming. I lift weights. You want to make it vigorous? Lift weights faster. I am of the belief that, strength is the fountain of youth. Muscle strength, muscle building is just fountain of youth. The recommendation is twice a week, but that's not true in Dion's world. I feel, especially as women get older, as we get older, it's just a part of of everyone's biology. You lose muscle over time, and muscle is similar to fat. It has a function. and it helps with controlling your blood sugar. You know, you eat a meal and then you go walking, or you eat a meal and you do some kind of housework, your muscles are going to draw that glucose, the sugars from your meals into itself for energy, right? As we get older, strength training, I mean, I'm sharing the recommendations by, you know, the American Heart Association and health departments and all of that. But I do a lot of research and investigation in, you know, exercise and training for women as we get older. And 2 times a week really is not going to cut it. And I'm just going to say that. But the first step is move more. Don't make it complicated. Start where you're at and start. You know, I'm not going to tell you that, you know, tomorrow is day one of 150 minutes a week of moderate exercise. That is that is unrealistic and unfair. Start where you start. If you're completely sedentary, you know, going for a 5-minute walk after lunch on your lunch break has already moved you in becoming more active, right? Make it fun. Ask me what I did on my birthday. My sister and I took our family, our children, and our spouses to go play pickleball because that's our fun. That's our exercise. That's how we move our bodies in a way that's fun. And I tell you, we got 2 courts. The kids were on one court learning how to play. Donna and my husband and I were on the other court because we already knew how to play. And, you know, 2 hours of fun and exercise. Boom. That's 120 minutes. There you have it. Roping your friends, roping your coworkers at work. You know, we used to go for walks. We used to, our hospital, in an attempt to try to encourage movement, they've actually outlined a mile within the hospital. It's called a Monty Mile. And you walk 4 laps and you've walked a mile. We used to do the 4 laps and then walk right out the door and cross the street to the parking lot and walk from the ground floor all the way up and then all the way back down, because we were trying to be very deliberate in moving more, right? Roping roping your friends, roping your colleagues, roping your family members. You know, if you have a dog, great excuse to go outside and walk your dog, but make it fun and find a way. It's not impossible. Exercise really is a celebration of what your body can do. It's not punishment. It's not, you know, getting on the treadmill for 45 minutes and just waiting for it to be over. And, you know, you count from 45 down. You start from zero and you count up. Celebrate what your body can do. We take our vitality, we take our ability to move and to do things for granted. That's my spiel. Blood pressure. This is another screen for taking a screenshot. Ideal blood pressure 120/80. You heard what I told you. I was almost 200 over something like 150. Ridiculous. And that was how I was walking around. You know, it's very interesting. You know, one of the things when it comes to paying attention to your blood pressure, it tells you to sit down, be calm, wait 5 minutes, and then take your blood pressure. And the likelihood is you're going to have a lower blood pressure or a blood pressure that's not as elevated. But is that your true blood pressure? Your true blood pressure is the blood pressure where you're walking around living life. And so they teach it, they recommend it. And Dion, I just don't think that is what your blood pressure really is. Your blood pressure is, I'm gonna stop right now and take it because this is how I'm living my life. This is the blood pressure that I'm walking around with as I am living, right? As I'm doing life. So the ideal blood pressure is 120/80. You have to reduce salt intake. Again, get used to not having the salt. Exercise will bring down your blood pressure by itself. Stress reduction, very important. Stress really creates elevation in our blood pressure. Medication adherence, while it is not quote unquote a lifestyle change, it is a habit that we need to develop if you are on medication. If you are on medication, get into the habit of taking it, not just when it's high. Unfortunately, my mom, hypertensive as long as I've known her. And blood pressure medicine only when it was high, only when she had a headache, as if all the other times the pressure wasn't high. I'll take my garlic tea, I'll take my this, I'll take my that. The whole time, high blood pressure is ravaging her system. I'm grateful she's still alive. She's about to be 89. Actually, her birthday is coming up. She's about to be 89, but she has suffered the effects of having uncontrolled high blood pressure for decades. You know, she's had several strokes. She's now diabetic. She's been diabetic, not now, but she's been diabetic for a while because we don't want to adhere to the medication. For some reason, people like to think that, you know, we get a kick out of writing prescriptions. And that's not the mindset. You know, medication work once lifestyle changes are not able to do what we hope it can do. Like, again, if there's family history, if you already have things that are against you, you know, you can do all the things. You could change the diet, you could exercise, you can lose the weight, and you still can struggle with some of these things. And that is where medication may be necessary. And I mentioned monitoring your blood pressure at home and keeping track of it, right? Um, having a diabetes, having a eating a healthy carb conscious diet, monitoring and tracking your blood glucose and A1C. If you're diabetic, you know your A1C, or for those who may not know, your A1C really is, I like to think of it as the truth. You'll go to your provider, you come and say, oh, my finger sticks has been great. What has it been? It's been normal. You know, they show you, you know, their lodge or their ledger of what their finger sticks have been. But then you do an A1C. And A1C gives you literally a snapshot of how well that person's blood sugar has been controlled for the previous 3 months. So you could tell me what you want to tell me, but your A1C is going to tell me the truth. So pay attention to that, because A1C that is increasing is an indication that your diabetes is not being controlled. Implementing more movement, again, like high blood pressure, moving can help reverse the severity of diabetes, if not reverse it entirely. And manage your weight. Weight management is very important in controlling if you're a diabetic. Know your numbers. Know what your cholesterol numbers are. Your LDL, what I mentioned, was the bad cholesterol. ApoB, not a lot of places are implementing this blood test, yes, yet. But it's a newer blood test, and it's considered to be a better marker for heart disease. But like I said, a lot of doctors are not yet using it. Know what your HDL is. HDL is your good cholesterol. HDL you can actually increase with exercise, and it's cardio protective. Know what your triglycerides are. Know your numbers. You need to have a diet with lean protein. Avoid saturated fats that are found in fatty meats, full fat butter, processed snacks, pastries, fried food, all the stuff we like to eat, all of it. You know, we have to avoid it, change the way we eat. I mentioned exercise raises the HDL, and we need to implement more fiber-rich foods into our diet. Smoking. Smoking is an addiction. It's easy to say, I want to stop, and, you know, requires help. It's smoking cessation is one of those things that really is more successful when there's like a multifactorial approach to stopping. And that would include counseling, using a nicotine replacement, and support groups. Excuse me. Stress management. We have to prioritize sleep, aiming for 7 to 9 hours. Practice meditation if that's what you're able to. Therapy, physical activity, hobby, self-care, taking care of ourselves. Chronic stress increases inflammation, raises blood pressure, increases body fat, obesity. It's all of the things, right? Okay, so I've shared a lot of information, but It's not information for the sake of information. It's not just so I can spit out facts at you and have you walk away with a head full of knowledge, even though knowledge is power. If we want to make a change, we have to implement some actionable steps. Like, what are some of the things we can actually do? We need to be able to know our risk factors. Choose one lifestyle habit to change. Anyone have heard the adage of how do you eat an elephant? You eat an elephant one bite at a time. You can't overwhelm yourself with wanting to change everything all at once. Choose one, hyper focus on one. Like, if you want to hyper focus on moving more, and then just be conscious of, maybe I shouldn't eat that, or maybe I shouldn't eat this, but hyper focus on one lifestyle habit that you want to change and be consistent with it. Um, Partner with your provider. You have a lot of information that I've shared that now you can go back and have a discussion, ask the questions, voice your concerns. Is there information that you now know you need to share with them, right? Like, does your doctor know that you had diabetes when you were pregnant? Give them the full picture of of who you are, health wise, so they can help work with you. It's a partnership. Do they have resources that can support your path to change? Either within their establishment, their practice, or within the community that you can be referred to. Keep track of your success. Write it down, take pictures, celebrate your wins, and share with those who are close. Get your own cheerleader squad and be gracious and patient with yourself. It's very difficult to change behavior and habits. To change your lifestyle will not happen overnight. It is a process that will take many months, if not years. Okay, these are key takeaways. But before I share some of my key takeaways that I want you to take away, I'm going to ask, open your mic, share some key takeaways that you're going to walk away with after this evening's talk. What has resonated with you? What has surprised you? What has, what has made you, pause and want to reflect?
Hi, good night, ladies.
Hi.
My name is Kathy. I'm a friend of Aisha. She invited me on tonight. As I was listening to the presentation, just a little bit of background. I'm from a family with a lot of the risk factors associated with cardiovascular disease, hypertension, diabetes. My mom has hypertension, diabetes, peripheral artery disease. Last year, she underwent bypass surgery as well as aortic replacement. And that was due to a number of years of having hypertension and diabetes. One of the things that resonated with me was when you were talking about some of the signs and symptoms. And I remember very clearly in 2016 when my mother would basically have her first incidence of a heart attack. She basically called me one morning and said to me, Kathy, I'm having heartburn, but this heartburn is going down my left arm. And I said, Ma, you can't have heartburn in going down your left arm. I kind of chuckled for a second. And I remember clearly that morning that I was actually going to work in the clinic. I worked as a dialysis technician at the time. And I thought to myself, I said, oh no. Know my mom. She's never had heartburn a day in her life. And then on top of that, she was saying she felt the heartburn going down her left arm. And it just felt weird. And I immediately called her doctor, and the doctor was like, no, she needs to go to the emergency room right away. And literally, God was with me. I lived in Queens, and I was heading to work on the Belt Parkway in Brooklyn, and I don't know how I got to my mother's house so fast, but God was with me. I got to my mother, grabbed her, and drove straight to the hospital where our primary doctor had actually called ahead, thank God, and had people waiting for us. And it what ended up happening was that she ended up having three blockages or partial blockages in her Widowmaker, her LAD.
Mm-hmm.
She was alert and oriented. She never lose consciousness. She was actually cracking jokes. And, one of the other things is that, women present differently than men. They're not grabbing their chest and say, oh, my heart hurts or my chest hurts or the pain. A lot of the times, like you were saying, a lot of women are overlooked. Simple jaw pain or something like that, a lot of times it's overlooked. And like I said, that morning she was just saying, I just have this weird heartburn going on my left arm. So I just want to just thank you for emphasizing some of these symptoms that women exhibit. A lot of the times, we ourselves, may have family members that might have exhibited symptoms like that in the past or probably even recently and not even put a second thought to it because, most people, unfortunately, or according to what we know on social media or through television or movies or whatever, we always think it's the, simply grasping the chest and collapsing to the floor. So I just want to applaud you and I just want to just thank you for just, putting light on those symptoms. And I just want to encourage you to keep doing what you're doing, just wonderful information. So I
Thank
just
you.
want to thank you again.
Thank you, Kathy. I all praises to the Most High. I'm trying to walk in my gift. Like I mentioned earlier, I appreciate you sharing that. That is such a typical story. It lines up so beautifully with everything that we've discussed here. I'm glad your mother was intuitive, listened to her body. We make excuses. She had enough wherewithal to pick up the phone and call you. And even as much as it didn't make sense to you, who has heartburn out their left arm, right? Mom's crazy. But you did the best thing that you could have done, which was to reach out to her doctor. And gratefully, yes, gratefully, the doctor did the right thing. Yes, Precious, I see your hand is up. You can open your mic and ask your question or make your comment.
Yes, quick question.
Sure.
When you say you're having heart pain, is it like a pinching?
You have what?
Like a pinching?
I didn't hear the first part of your question. When you're having a what?
Wait, heart pain. Heart
Oh,
pain
okay.
is similar to pinching, like a pinching of your heart, like just a slight tightness and then it goes away.
Well, it's mostly described as squeezing. It's described as pressure, crushing pressure most often. Um, there is no one typical way. It can feel like heartburn because, heartburn is a burning sensation. So there's no one way to describe it. It's going to be, and it's seldom only going to be one thing, right? It could be just the one thing, right? But you may have sweating, nausea, dizziness, um, diarrhea, going to the bathroom. It's so to answer your question, could it be pinching? Yes, it's not one of the most common ways it's described.
So I go to see my cardiologist tomorrow, just so happens. So I should let her know about it.
Please do.
Okay.
Please do. Thank you. Appreciate it. Anyone else with any takeaways they wanted to share before we move forward?
I have a question. How often should you see a cardiologist? Is it only if there are like issues, or what if there are issues? Should people be putting that off? What is your take on that?
Definitely don't put it off if you have issues. You seeing a cardiologist will depend on your situation. If you have a heart condition that's being treated and monitored by a cardiologist, you should have a relationship where they're letting you know how often they want to see you. It really shouldn't be, well, I feel like seeing my cardiologist. There should be a relationship and some kind of plan where I need to see you every 6 months, every 3 months, every year. It's going to depend on what you're being managed for. Um, and you speak to your primary care provider, and then you ask them if you have concern, like Precious mentioned. I just need to know what to ask or what to tell them. Speak to your provider. We've had some topics that we discuss about specific risk factors for women. If you find that some of these relate to you, speak to your provider, your primary care provider, and discuss. Do I need to be seen by a cardiologist? Do you recommend I see a cardiologist? It's really going to be an individual basis.
Good night, ladies. This is Yvette. I'll just share my stories that I'm on a fixed schedule to see a cardiologist. So I go like every 6 months.
Mm-hmm.
And one of the biggest tests that he has me do is that he goes by my calcium testing. So I go for calcium testing,
Mm-hmm.
and he uses that a lot. And
Mm-hmm.
I don't know if in your expertise, is that something that you guys go by, but he goes by calcium testing.
Mm-hmm, mm-hmm, mm-hmm. Yes, that's a calcium score. So that is a very it wasn't a part of the conversation because that's more about diagnosis and monitoring heart disease. But yes, your cardiologist is doing the right thing in having you do routine calcium testing based on whatever it is that you're being managed for. I'm going to just go ahead and finish with my takeaways, and then we're going to come.
Can I share something?
Yes.
I'm hoarse. I'm sorry. Good night. This is Charmaine.
Good night, Sean. What's up?
Share the experience I had in Jamaica. 2008. I went to Jamaica on a vacation for a week.
Mm-hmm. So
the night before, of course, always have packing late and all of that stuff. So got to Jamaica. Didn't get any sleep at all because I said I'll sleep on the plane. So the following day after I got there, I went to the restroom and I came back and my heart just started beating real fast. Never stopped. I said, probably because I'm hot, let me sit outside. But it never slowed down. So I ended up going to the hospital. I ended up going to the emergency room. They gave me medication and it kept me in the hospital for a week. Total bed rest. They discharged me the day I was. Oh, I don't remember the name of it, but my heart just keep going.
mm-hmm.
It was really beating real fast. And so they gave me medication and took care of it. So I spent a week in the hospital and came home the end of the week back home. So when I came back home, I went to my cardiologist here and they did the test with a groin. They put that thing up. I don't remember the name of these tests.
Cardiac cath.
Yeah, and so there was no blockage or anything like that. And we did other type of tests, but there's nothing wrong. But now, today, like a couple of days, I start feeling like a flutter in my heart. So I go to the cardiologist once a year, but I missed going there last year. So I call and I get an appointment to go see them next week, where they're going to give me something to wear for a month to monitor my heart. So just in case anything go wrong. So I'm just sharing it with you guys.
I commend you for, we have to pay attention to our bodies. Only we know what's not right within ourselves, right?
Mm-hmm.
And so we have to advocate for ourselves. We have to pay attention, and we have to say something is not right. And it sounds like from each of you have shared that you are being managed well by your providers. Yes, so they're going to put you probably in a Holter monitor, which is going to monitor your heart rhythm, and then they'll analyze that and see if you have that. One of the things we mentioned earlier in our slides, arrhythmias. The heart is electrical and it fires off, and that's how things gets. That's how contractions are initiated, and sometimes there are parts of the heart that start setting off electrical impulses when it shouldn't be. So sometimes you can feel like you have this fluttering or this heart racing. So the Holter monitor should be able, if you're having these episodes, to pick that up. All right, ladies, that was great. All right. Key takeaways. Heart disease is a women's health crisis. These are the things I want you to take away. It's a health crisis. Don't ignore your symptoms. Many risk factors are preventable and reversible by changing the way you live your life. Advocate for yourself and the women in your life. And I just love this. We mentioned, it was already mentioned, Kathy shared, she advocated for her mom. She's like, that don't sound right. Call the doctor, got her to the emergency room, listen, don't ignore your symptoms. Like Charmaine just shared, I'm having this palpitation in my chest, call my doctor. These are the things that we have to do to advocate for ourselves. These are some helpful resources that you can go to, goredforwomen.org or heart.org. A lot of resources for women and heart disease. And I'm going to close with the scripture, Ephesians 5:29. For no man ever yet hate his own flesh, but nourishes and cherishes it, even as the master, the assembly. Our body is our temple. Let's be good stewards over it. And hallelujah.
Hallelujah.
We did it, ladies.
Yeah.
We did
Hallelujah.
it. I heard some men in the background supporting their wives, and I love it. Thank you for being there. The
We have
floor.
quite a few questions.
Bring the questions. I got 2 bottles of water. I'm ready for it. Let's go.
All right. So, Danielle asked a question earlier about the estrogen thing. Were you finished with that thought about it?
Yes. No. Estrogen, I mentioned, it helps relax blood vessels. It helps with fat metabolism, moving fat out of the bloodstream. Those are the 2 major things that estrogen does, because once we women enter menopause and perimenopause and menopause, those are the 2 things that we see change. Blood pressure increases, blood vessels stiffen, cholesterol starts to go up. So we can see kind of its impact once it's removed from us. Once we no longer have it circulating.
Wonderful. All right. Sister Kadasha asks, can the vessel walls be repaired? If so, how can we heal our vessels?
The vessel walls, the body does try to heal itself. That's part of the reason why a thrombus, a clot, is even developed. But when there is severe injury, what we need to do is to prevent further injury. We need to things that we can do to help heal the vessel wall is to decrease the insult on it, blood pressure, glucose, and inflammation. Inflammation is a huge driver of a lot of chronic disease within the system. So we have to find ways to decrease the inflammation within our body. Body fat increases inflammation, stress, physical, emotional stress causes inflammation, increases inflammation. The foods that we eat, we have a lot of inflammatory foods that are part of our diets. Those are things that we would have to adjust to try to help the body to heal itself.
Thank you. And to clarify, are you saying insult?
Insult, yeah, or injury.
Okay, all right. Just making sure. We had a question of the wording you were using.
Okay.
Sister Elisheba is asking, is it true that a woman could have had a heart attack and not know? And what studies could detect that?
Yes. And I've seen it. I've seen a woman come in, has heart failure out of nowhere. And her ejection fraction, which is what percentage of blood it leaves the heart when it beats. That's a function of an assessment of how strong the heart is, right? So a decreased ejection fraction, what's caused this injury? You can see through various studies where
You froze, MoriYah. Oh no, what happened? MoriYah, can you hear me? Oh my gosh. Eliana, if you're there, can you tell your mother she froze?
how we present with heart attacks.
Okay.
So yes.
You were frozen.
Oh, Eliana just came out.
To tell you, yeah.
I have to start over? Okay. So, yes, women can have a heart attack and not know it. I've seen it where a woman would come in with newly diagnosed heart failure, and it's unsure why it's developed. And when they've done their studies and they've done their assessment, they see that she has had a heart attack. Women have silent heart attack more often than men. Men will be the ones that would have the heart attack while shoveling the snow, and the woman would have a heart attack sleeping in her bed. That's another big difference between men and women. So yes, women can have silent heart attacks. To answer your question, yes.
All right. Thank you, sis. All right. So Sister Retitia's asking, does fasting and diet changes help clear plaque?
Fasting, dietary changes, yes. I think I mentioned that when I discussed having a healthy plant-based diet. And we saw, and there is evidence of reversal of the narrowing of the blood vessel wall. Fasting helps with dealing with inflammation within the body. So fasting can help with the inflammation, not so much with the plaque reduction within the blood vessel walls.
Amen. Good question. You did mention about strength training, but Denasia wants to know, is there a certain amount of time that should be spent on strength training?
You know, it depends on how old you are. The younger you are, the more you can get done. I mean, like, because strength training is a stress on the body. It's a good stress. It's not a stress that we should try to avoid. But as we get older, as and we enter into that perimenopause, especially, and menopausal years, stress is stress. The body reads it the same way. So while 10 years ago I may have gone into the gym and done a weight session for an hour and a half, the older you get, you have to train wiser, and so now you're looking like maybe 45 minutes to an hour. When you're younger, have at it. Lift the heavy stuff, push it over your head, lift it off the ground, have fun with it. But and again, when weight training, it kind of depends on your goals also. If you're training for strength or endurance, if you're training for strength, it may be a shorter session compared to if you're training for endurance, which will be a longer session because you're trying to build the muscles to be able to move on over an extended period of time. If you're asking what should you do tomorrow when you go to the gym, and it's you, Donasia, and you're 33, go in there for an hour, make it happen, Captain.
All right. All right. So we have two more questions in the chat, and then I see we have one hand up. So Daniela's asking, can hypotension cause damage to your cardiovascular health as well?
Hypotension causes causes decreased blood supply to your brain, and you will fall down. It causes its effect is fainting. Low blood pressure is dangerous, but it's not to the point where it's going to cause like disease development. It can cause some hypoperfusion or decreased perfusion because the pressure isn't adequate to get to where it needs to go. But in regards of heart disease, low blood pressure is not a danger.
Thank you for that. That was a good question, Danielle. Elisha was asking about the A1C. Is that the one you have to do when you're fasting?
No.
Okay.
No, that's just a regular blood test that can be done at any time. Because remember, the A1C is telling the truth. It's telling you what you've been doing for the last 3 months. You don't have to fast for that.
Okay, wonderful. So that's the last of the questions in the chat. Sister Kathy shared a very good, two good resources. One you already shared, the goredforwomen.org, but also atlas.heart.org, something else that Sister Kathy shared in the chat. Sister Elisheba, I see your hand is up, sis. Go ahead and open your mic.
Shalom.
Sure.
So, one part of my question from earlier was so if you don't know, but you have a family history that has heart disease issues, and you want to see like did you ever have a heart attack? How would you pose it to your provider to run those tests and which tests those should be?
I guess it would kind of depend on why you're asking. I would have to be. I mean, if there's no, if you come in, if you come to your provider and you say, "I want to know if I had a heart attack," well, I'm going to ask you, why do you think you had one? You may have uh, normal blood panel. You may have normal cholesterol. You may have a normal blood pressure. You may be no indication for me to suspect that you have had a heart attack. It's going to be difficult to kind of steer you towards further testing without, it being evidence based. Like, why are we doing this? If you come to me and you happen to have, I'm looking at you and you happen to, you're telling me I used to be able to walk a block without a problem. Now I have to stop halfway through. I get so tired. And, if there are other indications, and I'm like, you know what? Let's see. I may not be looking to see if you've had a heart attack, because that doesn't change anything if you've had a heart attack. What we're going to deal with today is, are you at risk? What are your risk factors? Do you have cardiovascular disease? What do we need to do moving forward? Not so much what already has happened in the past.
Mm.
Okay, good. That's a good question, Sister Elisheba.
I wanted to mention something if whenever there's a moment.
There's a moment.
Okay, so I just wanted to share my experience because it may actually help someone. So similar to my Aunt Charmaine that spoke earlier, I had a situation a few years ago and also last year in which my heart was just racing uncontrollably. The first time I got hospitalized, I initially didn't think it was a big deal until, and it happened while I was sleeping and got up to use the bathroom. So until I saw that it wasn't going away, it got to the point where I was just extremely weak, like really weak. I could barely move. It was a period of time where my husband was hospitalized for a while. And as a woman, a lot of times we may think we're not absorbing stress or we're not stressed. We may not necessarily feel it, but our bodies, we can't outsmart our bodies. So even though we may deny the fact that, you may not have had sufficient rest, or you're just doing too many things, our bodies remember that. So one of the things that I want to encourage everyone is get enough rest. If you don't have enough rest, if you're not taking care of you first, you can't pour from an empty cup. And as women, often wear so many hats and we're the strength of tower for everybody else, but we have to pay attention to it. It may sound selfish, but we really have to pay attention to ourselves first. Notice when you're traveling, when you're on an airplane, they always tell you to put on your life vest first, put on your oxygen mask first, because without taking care of you and without saving yourself, there's no way that you can save someone else. Another thing that I wanted to mention is, not making sure, but electrolytes. Like in my first situation, my electrolytes were severely low and diminished. So my heart rate was literally over 150 beats per minute. Any little thing triggered it to go higher. If I made a movement, if my cell phone beep, just anything at all. So making sure you're hydrated as well, making sure that you have your electrolytes. It's very important. But ladies, we're probably all guilty of it at some point or another. But we have to take care of ourselves first. We're no good to anybody else, really, if we're not good to ourselves.
Amen.
Amen. Thank
Wonderful.
you for sharing. I appreciate what you shared. It's all very true. We just have to, it's not being selfish, it's being wise.
Amen.
Ima Deborah, you can open your mic. I see your hand is raised. Hey, Ima.
Shalom, everybody. I just want to thank you for what you are doing. It is so very needed. And like you say, a lot of us don't know this information. And I praise the Almighty for giving it to you. Because as a few of y'all know, I'm walking through everything you just talked about. I didn't know when I had my first heart attack. And I say first because I had two. And the Almighty was good. He let me walk away from two heart attacks. But when I had the first one, I didn't realize or know some of the things that you were talking about. And I didn't had talked with my providers to get the information that I needed to walk different, change things, change how I ate. Well, they would tell me, the normal things, don't eat beef, don't stop your salt, but they didn't tell me how to do it. Plus, they didn't really go into my family history. That was a big thing. I had a lot of these risk factors, the high cholesterol, the high blood pressure. I smoked, I was overweight. And I did not know that on my father's side, half of the people on there had heart disease. I did not know that. That would have been something very, very important for me. It may have stopped me from waiting till I got 23 years old to pick up my first cigarette. Now, did that make sense? It would have made me do things different had I known. But now, after the second heart attack, and it was a blessing because then I ended up having another one, not doing the things that you said. And this one was open heart. They had to crack my chest. The first one I got stents. The second one, they cracked my chest and I had a stroke. And as y'all know, Father, Yah is good. I came a long way. When they were, how Danielle said that, the power to move is underrated. She is so right. Because y'all know when I came out from under that, from the neck down, I could not move. Now I'm in a wheelchair and I thank y'all. I am so grateful. I can sit on it. One of the first things I wanted to do was when I got out the hospital this time, I could sit on the toilet and flush the toilet. Dude, we take things for granted. But that was a thrill I was on a potty for so long after I could get up out the bed to get on a potty. At first, I had to end the bed, and that's so hard to do. And my son was changing my diapers. And I know he didn't want to do that, but he looked at me, you my mother, I'm going to do everything I have to do for you. But that was hard. And I'm so grateful to the Almighty we made it through that. But I want to tell everybody on here, listen to this, take this to heart. And like MoriYah said, just one thing at a time, one day at a time, it makes a big difference. And also, when you work with your provider and your cardiologist, ask to work with a nutritionist. That's what got me over the hump, as I call it, because now I understand how exactly I should eat for my body. And the main thing I do now is I don't buy processed foods or anything, but anything I buy and I cook at home is I look at my portion control, I look at my fat content, and I look at my sodium content. because I do have cardiovascular disease, which is not going to be cured, but we are working to control it. And my blood pressure is totally under control. And like as MoriYah said, when you could get to where they cut down your medications, it's a good thing. I used to go around with a bag of medicines. Now I got two.
Man.
And it makes a difference. Believe me, it makes a difference. So thank you so much for what you're doing. Oh,
Thank you for sharing, Ima. That was very powerful. I really appreciate you sharing, and um,
We have two
I'm
quick
grateful.
questions.
Mhm.
Sorry, Dee.
Yep, go ahead.
Then we'll begin to close out. So Janavia, sorry if I pronounced your name incorrectly. She's a two-part question. How does cultural norms affect how women take heart health seriously? And why do women of color tend to ignore poor health symptoms?
Um, I think culturally, that's part of we don't realize when we say these certain things run in our family, it's because the behavior is what runs in the family. The way we eat is just, passed on. And it's not so much that it's in my DNA, but it's in my behavior. It's in the way I had learned to cook. I remember one time my mother was cooking and she said, "Oh, it needs more oil," and I'm like, "Why?" And literally just poured oil in the pot. I'm just like, it didn't need more oil, but that was her gravy, and I was just like, that's crazy. So culture has a huge effect on everyone, and we are made to believe, especially if it runs in the family, that I'm destined to have this thing happen to me, instead of almost looking at it as writing on the wall. Like, if I don't make these changes, I'm going to end up just like my mother and my dad. I mean, I know for me that was a big impetus for me to make certain lifestyle changes. Both parents hypertensive, both parents are diabetic. Father had a heart attack or had his chest cracked open. Mom had a stroke. Yeah, I'm not going down that street. So I'm not going to assume it runs in my family. I'm going to assume that I am at risk for what has happened in my family, and I'm going to make choices to avoid it from happening.
Amen. I see your hand, Precious, but Elishaba's question might be kind of easy to answer. Are varicose veins related to heart disease?
Yep, yep. A varicose vein is high pressures in the venous system. If cardiovascular disease, heart and blood vessels. And yes, so to answer your question, it's inflammation of the blood vessels. It's can cause clotting in those blood vessels and poor circulation. And so yes, to answer your question, it is.
Thank you. That was a good question, Sister Elishaba. Precious, your hand was up.
I just wanted to say that it's also finding the right doctor. My regular doctor is a Trinidadian. And, he gives it to me. Listen, I know what culture we come from, but this is not acceptable. These are the changes that we need to make. When he saw something wrong with my heart, he was like, I don't know a Black cardiologist, but if I were you, that is who I would look for.
Mm-hmm.
When I found Dr. Heather, I mean, that woman asked me a million questions and then asked me if I had any questions. I'm like, no, I have nothing to ask you because you've asked me every
Wow.
living single thing that had nothing to do with my heart. Just so, and a young
Awesome.
doctor, it's so
Awesome.
nice to see. She's like, certain things that we see in us, they may not see. So I have to ask you these questions. It's
Amen.
so important.
Awesome. Awesome. That's so
Wonderful.
powerful.
Yep. Thank
Yep.
you. That's all the questions we have in the chat.
Ladies, thank you. I appreciate you guys choosing to be here to learn this information. I pray that it was a blessing to you and those who may be in earshot of it. I look forward to bringing you more information in the future. And thank you for writing it out for me. I was very nervous, but thank you. I'm just grateful we got it done.
Let's send her
Great
some
job.
love. Go to
Great
our little
job.
react and go ahead and send some hearts, send some
But Dee.
confetti. We appreciate everyone from being here. This is really just like a historic moment for us at Titus too, because we've never done anything like this. And I'm just excited to see how else the Father can use us to help serve his daughters in the body as believers. So you can keep an eye out on your emails. We're going to send you a sheet of feedback. And on that feedback sheet, we're going to also be asking you, what do you want to hear being presented that is towards us as women? Um, Being this beautiful melanated colors, not everyone has the same issues that we have. So we want to hear that so we can know how best to serve you. And without further ado, thank you all for being here. We really appreciate the love, and yeah, bless everyone.
God bless you guys.
Thank you. Shalom.
Welcome, shalom.
Bye. Shalom.